Well, good morning and welcome. I'm Jane Newmiller-Boostad, and I am the Program Manager for Helping Kids Succeed here in Hastings. We are in Hastings, Minnesota, and we want to welcome you to our long-awaited series on mental health. Thanks for taking the time to be with us today. I know everybody's schedules are very busy, and so it's good to have everyone with us. Over the course of this week, we're offering a series of different webinars aimed at parents, grandparents, caregivers, teachers, folks in the community that care about the young people around them. Each of our speakers is an expert in their field, and each webinar has really great information for you. In order to be on the webinar today, you registered on our United Way website, and just to let you know, your email information is confidential. We don't share those names, we don't share that information. We will use your email address to send a follow-up survey to you, and then also to share resources that our speakers are providing. So just wanted to let everybody know that. As we get started, I'm going to share a welcome screen here. And we definitely want to acknowledge the sponsors for our webinar series. Alina Health and Tom Lutz and Associates have both agreed to be sponsors, and we very much appreciate their support. All the webinars this week are free, and we encourage you to sign up for the others on Thursday and Friday as well. You're welcome to do that. Resources from each of our speakers will be available on our website after the webinar.
Well, this is Mary Mellick, and I'm the Executive Director at United Way of Hastings. It looks like Jane is having a little bit of difficulty with her internet right now. She should be able to join us back here in a moment. Just wanted to briefly let all of you know that United Way of Hastings has been in our community for over 55 years. So for those of you not familiar with the United Way of Hastings, we really work with many groups in the community. We have internal programs that we fund, and we also fund other nonprofits in our area that are providing direct services to individuals in our community. So we really are very thrilled to have you on board today. These webinars are free, and if you find them of value, please feel free to make a donation to the United Way of Hastings to help cover our costs. So I know that Jane is trying to get back on, but I'm going to go ahead and introduce Serene Bachman. Serene, I don't have your bio in front of me like Jane would have, but you know what? I would love for you to just tell everyone who you are, where you're from, a little bit about yourself, and we'll look to kick this off.
Great. My name is Serene Bachman, and I work at Dakota County in the Crisis Response Unit. I'm coming up on my 20-year anniversary there. I have also worked in child protection and adult intake and family drug court. So I do have a little bit of experience across several other departments. I am licensed as a school counselor, and I worked for 13 years as a K-8 school counselor. So I'm really passionate about children's mental health and giving our kids the resources that they need to be successful.
Great. Well, welcome. And we, I think, are ready to hopefully start this off. I see that Jane is back on board, and she will unmute herself so she can talk with us. We've had Serene introduce herself. And
great.
I think we're ready to get started, Jane. Hopefully your internet will carry us through.
Of course, on the important days, that's when it is not so friendly. We just have technology issues to deal with. Okay. Let me pull up the page that I wanted to share with everybody. What we've been able to do this week is use a tool called AHA Slides, and we have some questions that we have prepared for you. And so what I'm going to do is actually put a link into today's chat, and you'll be able to either type in this website at the very top, or be able to enter the link. Of course, now we're going to have a little non-cooperation. That's a little frustrating. Let me go to plan B here, and I will get you that link. What we basically want to know is the information is to get some feedback from you. as parents, grandparents, healthcare providers. And let's see if we can get that to come up. That's a little frustrating. All right, I'll keep playing with that in the background. In the meantime, we want to get Serene to be presenting. So Serene, I'll work on that behind the scenes. And if you want to share your PowerPoint presentation with everyone, we'll let you get going.
Perfect. I'm going to go ahead and launch my PowerPoint. And again, if there's any technological glitches, I appreciate your grace here. And also, speaking of Grace, that's my dog's name. And if the doorbell rings, all bets are off, and there's going to be a loud disruption to our audio.
Not a problem. We are all adapting in our new environment, so no worries.
Exactly. All right, let me get into the screen. So as I mentioned before, I work in the Dakota County Crisis Response Unit. So I'm going to spend a few minutes talking about the resources and the services that we provide to residents of Dakota County, because I think it's really relevant to what's going on here. And a lot of people aren't familiar with what we offer. So we'll do a brief informational bit about the Crisis Response Unit. Also, if you have questions as we go, I know we've allotted time at the end for questions, but I found that if you're waiting 50 minutes to ask a question, you might forget or lose interest. So you can go ahead and use the chat box at the bottom of your screen and type in a question so that I can address them as we go if you have a specific question that we can address quickly. So the Dakota County Response Unit is located at the Northern Service Center in West St. Paul. Our number's on the screen. We provide phone and mobile crisis 24 hours a day, 7 days a week. We also serve adults and children, and we deal with a wide variety of issues. Mental health is our primary focus, but we also do after hours child protection. We do after hours adult protection. We assist with referrals for chemical health and a wide variety of issues. So because we answer our phones live and there's always a social worker who answers the phone, we get a lot of calls from people who just need some direction, and that's absolutely what we're here for. Our purpose is to screen the call and triage what level of service is needed when we receive a call. We are going to ask some basic information, the name, phone number, identify the crisis that's currently happening. And we also are going to ask you some questions about imminent safety just to be able to respond in the best way possible. We work really closely with law enforcement, and when we do go on site, we almost always bring law enforcement. That's for our protection as well as other people's protection. So sometimes we send people directly to 911 if we deem that it's an imminent safety concern, but we can triage that and help you guys figure out what to do. Some of the resources that we offer and ways that we can help people. I think these are some of the most valuable services that we provide. We prepay and block out emergency therapy and emergency psychiatry appointments for adults and children in Dakota County. So what that means is typically right now, for a new patient for a psychiatric appointment with a psychiatric provider, you're looking at 6 weeks to 2 months out. And we have access to those appointments, and we can typically get you in 1 to 3 days. That is super valuable when you have adults and kids in crisis. Our goal is to keep you out of the hospital, to keep you out of needing a higher level of care. So that's something that's really pertinent to what's going on right now with mental health. And those are available to people who have insurance or who don't have insurance. So if you do have insurance, they will utilize your insurance, but you will not have a copay. Now, some people are having really large copays and they can't afford, and that's a barrier to them getting psychiatric services. So they'll bill the insurance, but they won't bill you for a copay. And that's a wonderful service. We also have emergency therapy appointments that we book in the same fashion. Those are typically a little more out than 1 to 3 days, but also very timely when you compare that. If you're having something going on urgently and say you need to see a therapist, you might not have 6 to 8 weeks to wait to get in for a new referral. So that's really valuable for adults and children. We also offer crisis stabilization services and referrals to a crisis bed. So just a little bit about what a crisis bed is. It's a facility in the community. Ours is located, it's called Marine's House, and it's located in South St. Paul. They're unlocked facilities, but they have 24-hour supervision. You have your own room, and it's a place where you can get some intense support for your mental health for a short period of time. And those are available to adults. We don't have access through crisis to children's crisis beds, but those are some things that are in the works right now. Another very valuable service that we can connect you with is medication assistance for psychiatric medications. If you're uninsured or you have a big copay and you can't afford that, we are able to pay for up to 3 months of medication while you might apply for insurance or figure out how to pay for that in another way. And those, we typically use in combination with our emergency psychiatry and our emergency therapy, because when people are uninsured, we just need to get them connected with the things that they need to stabilize. And then once some of that stabilization happens, you can explore insurance and all the other things that might seem overwhelming when you're having a crisis. We also do referrals to children's mental health case management and adult mental health case management. And those, I know there might be some people outside of Dakota County, so those happen through your county of residence. We have access to what's called a client specialist, and I typically use them to help people get connected with filling out the forms for medical assistance or the combined application form to get financial benefits. Again, when you're experiencing mental health crisis, just doing all those multiple steps and details for filling out lengthy paperwork that's required to get connected to benefits. You sometimes need someone who can walk you through that. So we can make referrals to that client specialist person in Dakota County, which is a wonderful resource.
Serene, could I ask a quick question?
Yeah.
I had the opportunity, I don't know if that's quite the right word, but my family and we were able to use case management services a few years ago. We had a family situation going on, and it really surprised me how comprehensive it was. And if I hadn't made a phone call, I would never have had access to that information. If someone who's not in a crisis at the moment wants to learn more about crisis response, is that something they can do without having to be right in the middle of a very difficult situation?
Absolutely. Again, we're staffed 24/7, and part of what we do is informational and help people figure out in advance of a crisis, what are some resources and some supports that are in place for you. So if a crisis occurs, you're not scrambling. What we know about crises is it impacts your brain functioning. So having some of that stuff spelled out ahead of time is very beneficial.
Great, really great.
Yeah, it is. And especially for children, if you're a parent or a caregiver of a child with a significant mental health diagnoses, having a children's mental health social worker can help you navigate the ins and outs of that, and it is fantastic. Our children's mental health social workers are fantastic. They're very skilled. They can help with treatment, residential treatment, outpatient treatment, just a broad range of ways that they assist. They can be involved in children's special ed or 504 planning at school that addresses mental health needs. that is really a huge asset to just have someone who knows the ropes and who's able to advocate for your child and for you. Another service that we offer that you can do a referral through crisis. Right now they're currently considered the same department, but we're expanding and growing, so it's going to be a standalone department pretty quick here. Is crisis stabilization, and we offer two kinds of crisis stabilization. It is family focused with involving the children and the whole family, because what we know about when a family is struggling, sometimes there's an identified client, the child, but really we know that the whole family is impacted by the crisis, and we work with the whole family because helping parents respond, helping children, we get more effective results that way. We have adult stabilization services which offer the same services, and it's just individual adults instead of the whole family. We are doing some face-to-faces right now. We do a lot of phone contact and Skype calling, and we use video conferencing, all of the things that other providers are doing right now, but we do have permission to do face-to-faces in the crisis unit as well as our stabilization workers. So know that I think all of our stabilization workers are doing some face-to-faces with families and clients. They can do a basic diagnostic assessment. They're going to evaluate mental health status and needs. They're going to do some skills training with parents and with children, and they can help with referrals to safe therapists, mental health providers. They can help with school stuff. So the goal of crisis stabilization services is to get you connected to ongoing supports that are going to be in place long term. So it's not a long-term service. It's typically 6 to 8 weeks, but can go on a little bit longer if needed. Right now, our crisis stabilization services are kind of exploding just because of the sheer volume of need right now. And so there's about a 2-week wait on our list, but I would always encourage you to call, and we can triage that a little bit. And if there's urgent needs and there's some very specific information we have, that just helps us serve the families better. And our stabilization workers are all licensed. They're licensed mental health professionals, and they are fantastic at what they do. So if we're talking about resources for you in a crisis, I just included some crisis lines that, keep our number, 952-891-7171. But also, there's a crisis text line, which teens especially really feel comfortable when they can text because that's their primary mode of communication. There's a Minnesota Warm line that's included, and they're open 5 to 10 Monday through Saturday. That is more of a chat line. So in the crisis unit, we have some time parameters. We are not a chat line per se. We do spend a significant amount of time talking to adults and children about things that are happening in their life. But sometimes, depending on the volume of calls that's coming in, it might be that we have a shorter call than people would like. So there's other resources to get them connected with that kind of ongoing support. The National Suicide Prevention Line. These are great numbers just to print out and keep on your refrigerator. It will normalize them to just for kids to be able to see like, hey, these are some resources. And if I ever need this, this is who I can call. There's a specific teen crisis line that you can access through texting or through calling. So again, a fantastic option for teens. All counties in Minnesota have crisis teams similar to what Dakota County has. They all operate a little bit differently. I included the numbers for Ramsey, Hennepin, and Washington just because sometimes it's handy to have those numbers if you have grandkids who live in another county or you work in Dakota County, but you've got family in another county, just a few more resources to kind of help you. We talked about mental health case management, so I included the intake number for children and family mental health case management. And I just want to tell you a little bit about what will happen if parents call, and a parent or a guardian needs to make the referral for children's mental health case management. They're going to ask about, insurance, and they're going to ask about diagnoses, and there's an assessment phase to that where they gather all the things that they need and then refer it on to an ongoing children's mental health worker. It's important to know that if you are still in the process of getting a diagnosis, because that can be tricky right now with COVID, they will work with you during that process. I also included the NAMI Minnesota number because NAMI has fantastic resources for mental health advocacy. They also have parent support groups, and they have support groups for people who are experiencing mental illness. And there's a national helpline that I included up there. NAMI is fantastic. Can't say enough good things about NAMI. They're a wonderful, wonderful resource. And just a quick note about resources in Minnesota. There's a shortage of mental health resources right now, due to a variety of things, a big one being the pandemic. But here in Dakota County, we've been pretty proactive in getting people connected to mental health care in a timely fashion, because we know that helps someone experience long-term stability when they get connected faster. And we invest millions of dollars in our psychiatric and therapy appointments that we prepay for in books. So it's a big commitment, but it pays off. So I included, one of the questions that people were wanting to know is, when should you seek outside help with kids? Because a lot of you may work with kids or you have your own kids. If it's a medical emergency and I consider someone actively suicidal as a medical emergency, 911 is your first call. Crisis response also can triage, and if we think a 911 call needs to be made, we can plug you right into dispatch and be on the line with you to help you navigate that. What we know about the greater the level of the crisis, it kind of shuts down your brain functioning, and things that you normally might be able to recall sometimes get really difficult to recall. So it just helps to have somebody helping you navigate that if you're having a crisis or someone in your family is having a crisis. If a young person is at risk of suicide or harming themselves, you need to involve the parent, guardian, or caregiver right away, as soon as possible. If it's not urgent, but you know that there's ongoing concerns, involve them when it's appropriate and you have the ability to do so. A quick note, lots of times kids will say that they don't want you to involve their parents. What I've found is that if you're straightforward with kids about, hey, I'm really concerned about your safety, so I want to pull in anybody in your network that can help keep you safe. And that includes your parents because they live in the same home with you, or, if you explain to kids, and then it also gives parents an opportunity to show up with care and compassion, and you can prep them about good responses, and it just builds that connection between kids and their parents, because that's what we want to do. We want to build those connections so that they have that safety and they feel that comfort talking about things that are going on with their mental health.
Serene, can I ask just a quick question?
Yeah.
If somebody is in a setting like in a church youth group or maybe a church lunch, and they're just sitting there talking to a young person, and they hear something that very much alarms them, what would be the first? They're a lay person, they're not an expert. What would be the first thing that they should do when they hear that information that's very alarming?
So I would approach the kid kind of privately, if, just arrange to just have a quick word and just say, hey, like, I'm really concerned about something I just heard. I would love to talk to you about that in private. So when this lunch, when this whatever you're doing is over, would you stick around afterwards and talk to me? I would just love to talk with you a little bit about that.
Great.
Yeah.
That's helpful.
Yeah. I always give kids the choice. When I know that I need to notify a parent, I will say, hey, your safety is my primary function here. I'm really concerned about your safety. So would you like me to talk to your parents, or would you like me to be with you while you talk to your parents? You give them a choice about how you're going to talk to the parents, but you don't give them a choice about whether or not to talk to parents. So it's just giving them, like, do you want it to happen this way or this way, so that they know, I'm giving you some choice, but this is going to happen. Gives them a little bit of control. If somebody says that they're being abused, you would need to make a child protection report. Some of you might be working in schools or churches or somewhere which makes you a mandated reporter. So it doesn't mean that you have to know absolutely that someone is being abused. You're reporting what you suspect. Okay, you don't have to investigate it. You don't have to do an interview and get all the details of it. In fact, we would encourage you not to do that. You're going to just express, I'm really sorry that that's happening to you, and I do need to let somebody know about that because your safety is really important. And you make the report. You can call us if it's after hours. I think we have an error on the phone number there. The phone number to make a child protection report is 891-7459 during Monday through Friday, 8 to 4:30. But you can always call crisis, which is the number on your screen. And if it's during business hours, we can send you over to child protection intake. Otherwise, if it's after hours, we take those reports. And then when we take reports, we're also screening for imminent safety concerns and all of those things that happen just to ensure kids' safety. If there's violent or aggressive behavior, you're going to need to notify parents and get additional assistance. People ask a lot about, like, when do you refer somebody to therapy, or when do you know that something is a big enough concern that you need to get some outside help? So I just included a few of those situations. If there's aggressive and disruptive behavior, if it's been going on for 6 months or more, if there's ongoing suicidal concerns, if there's abuse, those are all situations where referring somebody right away is helpful. I also think it's important to talk about, what are some general boundaries and guidelines when you're talking with youth. I always say, be yourself. Don't try to talk to them in their lingo with their jargon, because that usually makes you fall flat on your face. So be yourself. Express your genuine care and concern. If they're coming to you, they're choosing you, and they're choosing you because of who you are in their life or their accessibility to you. So they don't need you to be an expert. They don't need you to be anybody other than who you are, which is a caring, compassionate adult. So just do what you do best. Be yourself. When you're talking with them, don't trivialize their feelings. And right now, during this pandemic, I will tell you that everyone is dysregulated, as probably all of you have experienced. And children don't have the same coping skills as adults. So everybody's experiencing dysregulation in some way, shape, or form right now. And just being aware of that, and being aware of triggers that you might have and things that you have strong feelings about will help when you're talking with young people. Don't ask why. Don't ask, why did you do that? Or why are you doing that? Those are questions that shut down kids and make them feel defensive. They're looking for validation for their feelings. You don't have to validate their behavior, but validate their experiences and their feelings. watch your body language, avoid crossing your arms and, real stern looks and things like that, 90% of your communication with somebody is your body language. So you're going to want it to be open and as relaxed as you can possibly be. I always say it's great to sit alongside somebody. If you're sitting across from somebody, that can sometimes make kids feel too much under scrutiny. So I like to sit kind of kitty corner or side by side and avoid that intense eye contact that might make them feel uncomfortable, especially teenagers. Look for ways to give them positive feedback during the conversation. And it might just be like, I'm really glad you're here. I'm really glad that you came to talk to me today. This is really important to me. Just validating that they made the right decision is really helpful. Younger kids might have difficulty expressing their emotions. One way to address that would be to, you're not looking very happy today. Can you tell me a little bit about how you're feeling? Sad, angry, frustrated? Just helping them give words to what they're experiencing can help. With older kids, they are more adept at talking about their feelings and identifying them. But honestly, right now, I think a lot of kids might not even have the ability to identify some of those feelings that are kind of underneath the surface. They might pop up in different ways. Just a quick note that kids who have a history of abuse and neglect, and a lot of us in the community have contact with those kids, they are at greater risk for developing mental health challenges. It's really important to be consistent and predictable with this population and to be honest and upfront. If you need to communicate with parents, tell them that. If you say, hey, I want to help you, and part of, I think, what would help you is to get a circle of people around you who can help you keep safe, then that's my goal here. Just communicating with them about what you're going to do, what you're able to do and not able to do. Okay. Some of us have brief interactions with people and don't have the capacity to be an ongoing support for them, and just to be honest about that, like, hey, you're telling me some really big things and I want to get you connected with someone who can be there for you on an ongoing basis so that you get what you need. If children are telling you about abuse or neglect, you want to communicate that you believe them and that you appreciate that they're coming to you to tell this to you, and to basically reinforce that there are adults who can be trusted and that they can feel safe with you. Do we have any questions at all? I buzzed through that. Anybody have questions about anything I've shared so far? I'm going to pop back into
if people have questions, you could unmute your microphone, or you could type into the chat, and
Okay.
we'll see those and be able to respond to those as well.
Okay. All right. I'm going to keep going. So people ask a lot of questions about suicidal thoughts and suicidal behaviors, and that is probably the number one issue that we get calls about with adults and with kids. We have parents calling on behalf, caregivers and concerned people, school staff, clergy. That is probably the number one issue that people present, and the second one is anxiety. And I will tell you that during COVID, there is a significant increase in suicidal thoughts across the board with adults and with children. Okay. And that, I mean, it's not surprising because we are in a collective experience of grief and loss with the pandemic. We're all experiencing grief of some sort and loss of freedoms and connections to other people, and with kids, events and social things that are really important to them as they are to us. But keeping in mind with teenagers, their primary support system is each other. So essentially, they were cut off from a lot of their support for a long period of time. And, it just helps us to remember, again, their brains aren't fully developed and they don't have the same coping skills that adults have. Some thoughts and statistics about suicide. There is no typical suicide victim. There's not one absolute reason for suicide. Suicide is always multifaceted. Ambivalence exists until the moment of death. And most people don't really want to die. We hear a lot of statements from people who call in that they just want it to end. They don't necessarily want to die, but they want the pain and the suffering to end, which is reasonable, right? That's something that I think we would all want. A person who is suicidal feels that their life is in crisis. They see suicide as a solution, not as a choice. Suicidal thinking by nature is irrational, okay? Their brain is profoundly impacted, and expecting logic and a typical functioning isn't realistic. Impulsivity and anxiety are always a part of suicide, and they feel overwhelmed with that. Here are some youth suicide risk factors. Mental health and substance abuse. I think it's 90% of people who have attempted suicide or completed have mental health difficulties. Interpersonal violence is also a suicide risk factor with relationships, peer relationships, friends, but also parents. Loss of valued relationships. A minute ago, I mentioned how with teens, their primary support system and the most important things to them at that age group are their peer relationships. So if they've lost a boyfriend or a girlfriend, that is devastating, and they might not always be able to see beyond that they could bounce back from that. They just know that they've lost probably what they consider the most important person in their life. A history of trauma in the home environment, and also big life transitions. Moving from high school to college is really stress and anxiety producing to a lot of teens. I'm including some warning signs. Talking about or making plans for suicide is a warning sign. Displaying severe or overwhelming emotional pain, and when they're expressing things like, I can't handle this, this is too much, I don't want to experience this anymore. We talked about not wanting to continue with the pain. Displaying behavioral changes that are significant. Someone who's normally pretty extroverted or outgoing all of a sudden becomes very isolating and staying in their room, not eating or drinking, severe disruptions in sleep, either sleeping way too much or not at all. And just a quick note about sleep. Sleep is the #1 predictor of mental health. So a lack of sleep, for whatever reason, that alone can cause mental health symptoms. With adults, with children, I have a personal example, if you don't mind. My daughter, when she was 21, her dad died, and her and I both experienced tremendous loss of sleep. And she got a really big diagnosis at that time that was related to symptoms of grief, loss, and sleep deprivation. So it is really sleep. I can't overemphasize how important to you sleep is to someone's mental health. And it's the first thing that people should try to stabilize when they're having mental health symptoms to see if they correct or go away. We talked about withdrawing or isolating, changes in sleep, anger or hostility that seems out of character. If you have a kid who's normally not real hostile and angry, but all of a sudden, becomes very hostile and angry, that's a symptom of something else that's going on, and it's okay to talk about these things and ask kids about these things. It doesn't increase those behaviors to shed some light on them. It actually is a relief for people when you shed the light on them a little bit. It gives them permission to talk about something that's going on with them. Agitation and irritability. Hello, how many of us are dealing with agitated and irritable family members and coworkers? And it seems the whole world is agitated and irritable right now. So that's a very common sign. So if a kid or an adult comes to you and asks you and tells you that they're having suicidal thoughts, or they're saying they feel helpless or hopeless, and they present as depressed and hopeless, you ask them, are you having thoughts of suicide? We do not want to ask if they're having thoughts of harming themselves, because that means different things to different people. We actually need to use the word suicide. Are you having thoughts of suicide? It does not make them have more thoughts. If they're not having thoughts of suicide, that's not going to cause them to have thoughts of suicide. Again, it's going to give them permission to talk about it, and they're going to take their cues from you, right? If you were okay with, we need to end the stigma that's attached to mental illness, and we need to talk about it. And are you thinking about killing yourself? Those are the two big questions that you ask. And you don't have to have all the answers on. We're going to talk a little bit about what to do if somebody answers that, but those are the two questions that you need to be willing to ask. This whole PowerPoint is available for you guys to download so that you don't have to try to keep copious notes on everything we're talking about. And all of the resources that I presented and the strategies we're going to be doing in a few minutes, those are all on the resources page, so you can have access to those. The first thing you need to think about if someone's telling you that they're having suicidal thoughts, or you need to think about how serious or urgent is this. And you would determine that by asking one of the three questions below. Have you decided how you would kill yourself? If a youth has come up with a plan, yeah, I'm gonna go home and take a bottle of Tylenol after school. That's a plan. They've decided how they're going to do it. Have they decided when they're going to do it? Have you taken any steps to get the things you would need to carry out your plan? And those are all, there's a lot of emotion attached to those questions. So if you're somebody who works with kids, or you as a parent are going to be talking to your kids about this, it's okay to talk to another adult and almost practice asking those questions, so that you can take away some of the, if you have that opportunity, to take away some of that emotional wallop that these questions pack, just to get yourself in a good place. All thoughts of suicide must be taken seriously. And I think nobody would disagree with that. And as a non-professional, I'm sure all of you would understand the urgency of that. So somebody disclosed to you that they're having suicidal thoughts, or they were planning on going home and overdosing on Tylenol, or whatever other details someone disclosed to you. How do you keep them safe? The first thing you do is you don't leave a person who is suicidal on their own. And if you can't stay with them, you arrange for someone else to do so, okay? You would need to contact a parent or guardian immediately. And if they weren't available, you can call 911. It is possible to have a child transported to the hospital if they're suicidal without parent permission in an emergency. But in the crisis unit, we always try to reach parents and involve them. The greater involvement of parents and the quicker response, the greater the outcome for a safe resolution. You can call if you're talking to a young person and they're talking to you about suicidal thoughts and you feel overwhelmed, you can call the crisis unit and we can triage that situation with you. We can talk to the student, we can talk to you. We can help you figure out what needs to happen. So you don't have to remember all the questions and all the steps. If you just know, hey, I've got a kid in crisis here and I need some help figuring out what to do, we can help you with that. I also included the suicide hotline on here and our crisis number again. So that's just kind of the fast overview of suicidal thoughts and a little bit of discussion about intervention. The second greatest call that we get in the crisis unit is about anxiety. And
Serene, before you go on, I just wanted to let you know we did have a really good question in the chat.
I couldn't see the chat. Can you read it to me, Jane?
Yeah. Is there a less intense question than "Are you suicidal?" that you could ask a teen or a person to encourage them to discuss their mental health, but maybe they aren't necessarily suicidal? You might know that they're experiencing some struggles,
okay,
but they're not quite to that point. So, would there be what would be a great question that you might be able to just bring up in conversation?
You could ask them how they're doing. You could say, "How are you doing? You look, you know, bring in what you're seeing. You look sad. You look stressed. Tell me about what's going on with you right now."
I love that question. I think "tell me about" is always a great one you can default to because it's very open-ended. I use it in marketing sometimes. It works in this setting too, I'll bet.
A question that I have used a lot with kids that I work with is, "Tell me something about you that I should know." And you can't believe the answers that I get. I mean, I've had kids disclose abuse. I've had kids disclose a wide number of things just by giving them permission. Like, "Tell me something about you that I should know." Yeah, that's a great question. Thanks to whoever asked that. So we're gonna move along to anxiety. And the symptoms of anxiety are physical, okay? So pounding heart, chest pain, rapid heartbeat, shallow breath, dizziness, headache, sweating, tingling and numbness. Young kids will frequently present with physical pain when they're having anxiety. Stomach aches and headaches, two most common, but also nausea, vomiting, diarrhea, muscle aches and pains, especially back and neck. How many of us don't get back and neck pain when we're stressed or worried or anxious about something, right? It's fairly universal. But I think the greatest thing that you can do for kids right now and always is to help them manage their physical bodies. That is, mindfulness strategies are not just a woo-woo, a great thing to do if you've got time and 8 extra hours in your day, but they're survival skills. And I can tell you that when I went through substantial grief and loss, I've utilized all the techniques that I'm going to talk to you about today, and I'm here today because of them. So I don't think we need to underestimate the importance of managing our physical bodies and getting ourselves in a calm and way that we can navigate through life. It's life-changing. There's psychological symptoms as well: excessive fear and worry about past and future events, racing thoughts, decreased memory and concentration. And decreased memory and concentration is also associated with depression. Also irritability, impatience, anger, confusion, sleep disturbance. Those are all symptoms. And then there's some behavioral symptoms too: avoidance of specific situations, obsessive or compulsive behavior, social distress, phobic behavior, increased use of alcohol and other drugs. Again, alcohol and drug use across the board is increased dramatically during COVID. I don't have current symptoms. I can tell you that we're dealing with a lot more chemical abuse issues in the crisis unit, but treatment facilities are overwhelmed. Wait times are longer for treatment. A lot of people are using drugs and alcohol to try to cope. It's understandable why they would do that, but it's not an effective coping skill, and it usually makes their symptoms worse. What are things that support kids who experience anxiety? And I am someone who experiences anxiety, so I can speak to this. Consistent routines, really important. Feeling like you have some control. And, with kids, there's a lot of things that are happening in their life that they don't have control over, so try to give them some control where they can. And now's not the time to be obsessive about your kid's room being clean or the things in life that aren't, we don't need to turn molehills into mountains right now. We just need to survive this and give yourself some grace and give your kids some grace too. Mindfulness strategies are helpful for everyone, and to do them on a regular basis. The focus is to calm your body and mind, because that reduces your own stress and helps you be able to cope. I'm going to walk you through some mindfulness activities right now. And the first one, so I use different apps myself for mindfulness, and I'm going to show you one this morning, and I'm going to put it on the screen. It's a breathing app, and you can use this with kids as little as 2 and 3. I have tried all these mindfulness strategies with my grandson. He's my little guinea pig, and he loves them, and now he asks to do them. I've got him hooked on sleep stories and meditations, and he thinks it's the bomb. So this application is called Breathe, and I'm going to start it right now, and tell me if you can see it. Okay, so it's going to lead you through inhaling and exhaling. Really simple, right? So you're going to look at the circle on the screen. You're going to breathe in, breathe out. When you have kids who are in distress, they're not going to be able to have a conversation with you if their heart is racing and their pulse is elevated, because they're in fight or flight mode. And we just need to get them to a spot where they're calmer. This is a fantastic way to do that, breathing. There's a lot of free breathing apps. Find one, download it. I actually use this myself. If I experience a really stressful phone call and like my body's tight, I'm like, okay, I need to do a few things to bring myself down. So that is a great one. That one's free. The next one I'm going to teach you is a wet noodle. Okay. All of these are in the resources. So I want you to just take 10 seconds and scan your body with me right now. Okay. I want you to start at your head and go down to your feet. Pay attention to any part of your body that feels tight. All right. So I'm going to tell you that my shoulders feel a little tight right now. Probably because there's a little bit of anxiety about speaking in front of a bunch of people that I can't read the room, and I don't know if you're all over there snoozing behind your camera that's turned off, or if you're like, rah, 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 Charlie Brown's teacher. So with my shoulders, I'm going to squeeze them up, hold them for 10 seconds, and then relax. Okay, so you can tighten any part of your body that feels stress. When you feel stress in your body, that's your sign that you need to relax and get those muscles in a different state. So the goal is you want to feel like you're a little bit like a wet noodle, like cooked spaghetti. Okay, you can do that with 4-year-olds. 4-year-olds understand that. And you can touch and go, oh, your body feels so tight. We're going to do like spaghetti. We're going to get you feeling loose. There is fantastic things on the internet with mindfulness activities you can do with kids. Teachers do them. Parents can do them. It's just a fantastic way. Okay, the last activity I'm going to do with you is called 5 senses. And this is for when you're trying to get out of crisis mode in your brain, and you want to be able to get engaged in critical thinking and get out of your reptilian brain. The first thing you're going to do is start with a few calming breaths. So you're going to breathe in, hold it for a second, breathe out. So you can do that a few times. And then you're going to notice 5 things that you can see. Look around you at whatever environment you're in right now and pick out 5 things that stand out to you. Like, oh, there's a bird outside my window. And look at that blob of snow on top of my hedge out there. And, oh, my neighbor is leaving the house. I wonder where they're going. So pick out 5 things that you can see. Maybe something that you usually don't notice. And then you're going to close your eyes and take a deep breath. And then you're going to think about 4 things that you can feel. The texture of your shirt. The smooth table that you're resting your arms on. The fuzziness of your slippers on your feet. And you're going to take another breath. Pick out 3 things that you can hear. I can hear the clock ticking. I can hear my refrigerator humming. Whatever you can hear, 3 things that you can hear. And then you're going to take another deep breath. And you're going to notice 2 things that you can smell, pleasant or unpleasant. I can still smell the bacon that I had for breakfast, a little bit lingering in the air. If you can't notice a smell, if you have a pristine environment with no smells at all, you can think about how the cold air is hitting your nose as you inhale, and then how it's warmer when you exhale. Outhale, that's a new word that I just created. Not exhale, but outhale. And then you're going to take one more breath. And you're going to notice something that you can taste. Take a sip of water, coffee. If you don't have anything handy, you can run your tongue over your teeth and notice how that feels. So kids can do this. At the end of the activity, you're going to be focused more on what's going on externally than internally. You're going to be calmer. You're going to be better able to think through what's ever going on. A quick final note about those activities that you do with somebody who is anxious or elevated. That's frequently the first thing I do with kids that I'm talking to is, okay, and adults for that matter, like, hey, we're going to breathe for just a minute here. We're going to breathe in through our nose, and you're going to scoop up the breath with your hand. So you're going to hold it for a second, and then you're going to breathe out. That will slow your heart rate down and get somebody in a position where they can not only hear you, but they can respond to you. So I talked a little bit about apps. There is so many fantastic apps for your phone. I've included some here, but I use the Calm app daily. There is a fee for that. I think it's $50-some a year. I use it every single day. There's meditations, there's sleep stories, which I am a huge fan of for anybody who struggles with sleep. But there's many, I mean, that's not the only one that does that. My Virtual Hope Box is a great one for teenagers. It includes built-in coping skills that you can upload, music that you can put on there that helps calm you. Music is a really great way for kids to calm, especially teenagers, like having music that calms them. There's some apps geared towards depression. Smiling Mind is free. It's geared towards kids. So take a, browse through and download some free apps and just try them out. You've got great options out there. So now we're coming up exactly on an hour. I can take questions. Anybody want further discussion about anything we talked about?
Let me just say that I know some of you are going to have to jump off, which is perfectly fine. We will be sending you an evaluation, so if you wouldn't mind taking a couple of minutes to respond to that, that would be really helpful. And the recordings will be up on our resource page. Serene has agreed to stay on for a few minutes, and so if there are folks that have questions, we'd be happy to have a little conversation with everybody. I'll put up our thank you slide, and certainly let you know that, again, thanks to Alina and Tom Lutz and Associates, but certainly let you know that all kinds of great resources. Serene has given us a lot of really good information, definitely some new things for me and hopefully for you as well. Also want to let you know we have light bulbs in our office. So if you want to stop by, Excel Energy was kind enough to donate a pallet of light bulbs to us. And you're more than welcome to come in when we're in the office. We're out today, but you're more than welcome to come in and pick up a couple. And of course, if you found the webinars valuable, a donation to support United Way of Hastings is always appreciated. So we will go ahead and pause. I'll go ahead and stop the recording. But again, if you'd like to stay on and you've got other questions that you'd like to ask, that would be fantastic. Thank you so much for taking the time to be with us. And if you have other suggestions for webinars in the future, please let us know.